We need to see just as loud of a conversation in and around the safeguarding, evidence-based interventions, the quality, the oversight, and the accountability required for this kind of care. And I've said before, the more precise we can be, about who will be served in these beds, is the intention here for people off the streets to be put into these beds, or was noted in the release, is it for people already in the system, needing an alternative level of care? That level of precision is really important, in addition to what likely and hopefully will come with the Mental Health Act review, the real need to look at quality. We look at quality in every other part of the health system. I think, have a road to go when it comes to looking at the quality and the oversight of care within the mental health system here in British Columbia. So those callers are right when they're calling for that attention to quality and oversight.
Would you call for that then, as they make these announcements, that there needs to be transparency and accountability built into any new beds announced?
Yes, I would say so. And we've tremendous confidence in the current health minister and the way she's framing that attention to the voluntary care system. And I think that same level of detail and transparency and accountability can come with these kinds of investments, and being as precise as possible about who these beds are intended to serve. There's just so many conflating issues, particularly given what happened after April 26th, the review of the Mental Health Act, the expansion of involuntary care, public distress on the streets. And there's, I think, a real need to wrap our arms around all of that and get really clear on the problems we're trying to solve collectively, and the improvements in the quality of life for people living with mental illness, and also the general public. All of those are really important considerations. And I think having a conversation more loudly than we're currently having around the voluntary side of the system, all of the things that supposedly become available when you're involuntarily held, we would hope that they're available on par when you knock on the door voluntarily. And the hope would be you could ask for that help once and get that help really, really quickly. And we know all too often that's a challenge for thousands of British Columbians today across BC.